Huwag kayong magtabi ni June.
Ha?
Nag-e-echo si Carl at saka si June.
Good morning, everyone. Welcome, everybody. The Philippine Pediatric Society would like to thank you for indulging our invite to attend this month's media conference entitled Pressing Concerns on Vaccination During the COVID Pandemic. We are now streaming live on YouTube. You may also log in to the Philippine Pediatric Society FB page. A link to this event will redirect you to the YouTube channel. So it's 10 o'clock, and I am Dr. Christina Patricia Tanbonleong Paras, co-chair of the Public Relations Engagement System Services of the Philippine Pediatric Society, also known as the Press Committee, whose members are responsible for media and public relations and in organizing discussion forums on relevant and timely pediatric concerns. I will be your moderator this morning. Before we begin the program, may I request our media guests and partners to add the media outlet affiliation or company before their name for proper recognition. Thank you all for attending. The press team has turned off the video and muted all participants. However, you may still create some noise in our chat box. Hellos are in order and most welcome. Good morning to all. Okay, shall we begin? Okay. To officially open this conference, okay. Oh, before we begin, you are also welcome to type in any questions or clarifications pertaining to our topic today, all of which will be gathered by the press team to be raised during our open forum. To officially open this conference, it is my honor to introduce the President of the Philippine Pediatric Society, Dr. Jocelyn Eusebio.
Thank you, Tin. Good morning, dear colleagues. For the last couple of years, we have witnessed the resurgence of vaccine-preventable diseases, notably that of measles and polio, due to very low coverage rates. Today's media forum is a testament to our society's ongoing commitment to uphold the value of immunization. Concerns such as fear of exposure to COVID-19 when seeking immunization services, queries on safety, rampant misinformation and disinformation from unreliable sources, and decreased confidence in government health delivery services are very much current and need to be addressed. As pediatricians, we are valued by the general public and scientific communities as trusted sources of information. We need to reassure the public that vaccines are safe, effective, and imperative. Let us join hands in reaffirming the need for catch-up immunization and support the Department of Health in their supplemental and routine immunization campaigns. I would like to thank the press for joining us today, our own indefatigable PPS media and Committee on Immunization teams, our speaker, Dr. Anna Ong Lim, and each and every one of you for spending this morning with us.
Thank you, Dr. Josie. Thank you for framing our expectations for today. I will now proceed with profound privilege to introduce our distinguished speaker. She is a professor and pediatric infectious disease consultant at the University of the Philippines, Philippine General Hospital, where she is a proud alumnus, having completed her medical degree, residency, and fellowship training at our country's only national university. She now holds the position of Chief of the Section of Infectious and Tropical Disease in the Department of Pediatrics of the UPPGH. She is a fellow of the Philippine Pediatric Society, serving as a member of its Board of Trustees. She is also the immediate past president of the Pediatric Infectious Disease Society of the Philippines. Dr. Ong Lim has authored several journals on pediatric health and infectious diseases. She is involved in clinical trials on vaccines, such as those for measles, mumps, and rubella, polio, pneumococcal disease, and influenza, as well as other studies like the treatment of invasive candidiasis. She's a regular speaker and resource person on topics related to pediatric infectious disease, vaccines, and clinical trials done in the Philippines and throughout Asia. Let us all welcome Dr. Annalisa Ong Lim.
Good morning, everybody, and thank you for the opportunity to speak to you this morning on this very critical topic. I'd like to share my screen so I can start this very brief talk and hopefully generate a lot of interest so that we can have a very lively discussion on vaccination. So I've been asked to talk to you about pressing concerns on vaccination during the COVID pandemic. And I'd like to just focus on two questions in this presentation. Just basically, first, what is the impact of COVID-19 in children? And what has been the public health impact on children, especially on vaccination issues? So to tackle the first question, I think we need to look at the more recent statistics coming from the country. We're quite familiar with this demographic distribution of cases. No? Inuulit-ulit sa atin parate na very critical ang older age group in terms of the degree of mortality or the number of deaths that are encountered. So kung titignan natin dito sa right side ng screen, makikita natin na pinaka-wide ang distribution doon sa mga nakatatanda, defined here as 60 and above because sila yung pinakamarami ang namamatay. If you will look at the left side of the diagram, you will see that the most number of cases are actually reported in the younger population. This will be a combination of your 20 all the way up to your 50s, no? Probably because sila yung lumalabas, nagtatrabaho, sila yung ating frontliners, and natural na sila yung nahahawa and sila yung mas nagkakasakit or napipick up as asymptomatic positives. Now, ang bata ba nagiging problema in terms of COVID-19? We will see here that as of October 12, we have reported something like 25,000 cases belonging to the 0 to 19 years age group. Now, typically, ang pediatrics, ang sakop niyan is 0 to age 18, pero dahil hindi disaggregated yung data ng ating reports, no, sinasakop yung 19, saka kaya tuloy siguro dumami ng mas marami-rami, no? But totally this only represents 8.5% of the cases. So kung tutuusin, hindi naman sila marami. And then kung titignan din natin, no, fortunately, in terms of deaths, hindi rin naman marami ang naapektuhan ng COVID per se, and COVID-related deaths in children remain low. So far, they've been reported at 127 cases. Now, globally, this is fairly similar because published data and anecdotal reports support the idea that it's a very small number of children who are found to be infected by SARS-CoV, and their clinical manifestations are much milder compared to adults. In fact, dun sa mga bansa na merong mga widespread surveillance and they've already published reports, China has a range of 2 to 12%, si Italy has 1 to 1.2%, Korea has 4.8%, and the US has 5% of its population, their total tested population being identified as belonging to the pediatric age group. And although, syempre gusto nating isipin na siguro naman kaya ganyan lang kakonti yung mga nagpa-positive and sana meron talagang proteksyon sa bata, I think we also have to recognize na factor din yung testing strategies and testing policies ng kanya-kanyang bansa para maapektuhan itong mga numbers na to. So ano-ano yung mga dapat isipin? Well, unang-una, hindi naman pare-pareho ang availability ng test sa kanya-kanyang bansa. Pangalawa, yung policies regarding testing, syempre tina-target natin primarily yung mga may sakit. And dahil yung mga lumalabas ang siyang karaniwan na nagkakasakit, madalang yung mga bata na matest. And usually, they will be tested only if they go to a healthcare facility dahil may simptomas sila na nag-overlap sa COVID, or household contact sila ng mga nag-positive. So maaring mas maliit na pool ng mga bata ang natetest, kaya hindi rin ganoon karami ang nakukuha natin. And then finally, as we've mentioned already, children usually present with mild symptoms or without symptoms, and thus hindi sila yung unang itinetest. However, having said this, we also have to recognize that all ages can be infected, and infants, in the same way that older individuals, the geriatric population, are the ones that are at risk, in the childhood population or the pediatric population, it seems that the infants are the ones who are most vulnerable. So with that as a background, pwede na natin ngayon tignan yung pangalawang tanong, which is, what has been the public health impact of the disease in children? So si WHO, as early as April, came out with this policy brief, and they talked about the impact of COVID-19 in children. And they shared that siguro hindi lang magkakaroon ng impact ang COVID-19 coming from the disease itself, but also, and more significantly, because of the immediate socioeconomic impacts of the measures to stop transmission of the virus and end the pandemic. It's actually the fallout, it's not the disease, and we're seeing that repeatedly being demonstrated in many different settings. And finally, on a longer-term basis, yung Sustainable Development Goals na tinatarget na ng pagkatagal-tagal ng United Nations, mukhang madedelay pa ng lalo dahil nagkaroon nga tayo ng pandemic. And specific ways by which children can be affected will include, first, falling into poverty. So alam natin to, marami sa ating mga pamilya ngayon are very challenged economically, and very significant ang impact nito sa kabuhayan ng ating mga kababayan. Pangalawa, although this is not specifically a health issue, meron ding problema sa learning crisis in that dahil hindi nakakapasok sa eskwelahan ng mga bata, syempre yung kanilang kakayanan to obtain an education and to learn new skills ay naapektuhan. Pangatlo, there's a significant threat to child survival and health, which I'll be talking about in more detail later. And finally, there are also risks to child safety. So the broader effects of the pandemic on child health are actually more significant than the direct impact of COVID-19 on children. And the hundreds and thousands of additional child deaths that will occur in 2020 can effectively reverse yung progress na nakuha na natin in the past 2 to 3 years. Yung makikita nating child mortality, makakatumbas siguro nung equivalent nung mga nangyari in 2 to 3 years, makukompress yan sa isang taon lamang. So let's look at specific threats to child survival and health. First, nagkaroon ng difficulty to access essential reproductive, maternal, newborn, and childhood health interventions. Nagkaroon din ng adverse effect on immunization programs. So ano ba ang nangyari? Nagkaroon ng suspension ng maraming polio vaccination programs worldwide. And the measles immunization campaigns that were supposed to target 78 million children up to the age of 9 years, lahat yun nawala na. Yung mga bata and adolescents na may sakit, tulad ng mga merong HIV, hindi sila readily nakakakuha ng access sa kanilang mga gamot and support programs. Child nutrition is also a vital concern. So alam din naman natin na maraming feeding programs na nagaganap sa mga eskwelahan. And in 143 countries, as many as 370 million children are going to be affected kasi hindi na nila maa-access yung kanilang meals na inaasahan nilang matanggap sa kanilang mga eskwelahan. When schools are closed and girls in particular drop out, ina-anticipate na natin na tumataas ang teenage pregnancy rate. So I know there have already been reports being shared in the local media of an increase, a significant increase in teenage pregnancy as a result of this pandemic. Then finally, yung WASH services na it stands for Water, Sanitation, and Hygiene are also at risk of disruption by the lockdown measures. And therefore, there's an increased additional threat to children's health dahil naman or nanggagaling naman sa waterborne diseases. So in terms of safety, ito rin naibalita na sa ating local media na nagkaroon ng increase in terms of rates of abuse dahil siguro na rin sa tension and stress na nangyayari sa kanilang mga pamilya. And of course, dahil hindi makalabas ng bahay yung mga bata at hindi makaiwas dun sa nananakit sa kanila, lockdowns tragically will also present an opportunity for child abusers to harm children. Nagsimula na ang pasukan and we've also heard about Zoom bombers, no? Na nagsasamantala, pumapasok sa mga classroom at nanggugulo and nagpapakita ng malalaswang videos and so on. And so the children's reliance on online platforms for distance learning increases their risk for exposure to inappropriate content and online predators. And finally, the combined effect of school closures and economic distress forces children to drop out of school, might compel them into child labor. In areas of conflict, the only way for them to survive is to join armed groups and become child soldiers. And in other high-risk countries, para na lang hindi sila karagdagang burden sa kanilang pamilya, ipinipilit silang ipakasal kahit sila ay mga bata pa. So, locally, nagkaroon na ng survey nitong June, si World Vision Philippines, and I just like to share it with you, because it shows very enlightening content. They had under 1,000 respondents. There were 20 provinces, across 20 provinces, 42 municipalities and 6 cities ang sinakop ng survey na to. So makikita natin yung demographic criteria. May bata, may matanda, may babae at lalaki, may mga representatives from the community, my child leaders, faith leaders, women representatives, and government representatives. So medyo maganda naman ang spread nung tinanong nila dito sa survey na ito. Na-identify ang tatlo as the most critical problems. First is food security, second is education opportunities, and finally access to healthcare. Now, sa larangan ng food security, ipinapakita dito na even if the FNRI says that a family of 6 needs at least 2,000 pesos a week to meet food needs, bago pa nag-COVID, mababa na to. Hindi na tayo nakakaabot dun sa 2,200 pesos na yon. In fact, only 1,800 ang average na food expense for a household of 6. And bumaba pa ito lalo to just less than 1,200 nung nagka-pandemic. Kaya nga, 68% of the households are not able to fully meet food expenses, 13% of adults eat less than 3 meals a day, and 10% of children eat less than 3 meals a day. So kung iisipin natin, gutom na sila and malaki ang impact nito sa kanilang paglaki at sa kanilang overall health. Nabanggit ko yung WASH, or water, sanitation and hygiene facilities. Well, nakita rin ng survey na hindi sapat ang drinking water and water that they can use for cooking. Hindi rin sapat ang availability ng toilets. Malaki rin ang kakulangan sa hand washing facilities, and napaka-significant nito, together with the limited access to hygiene supplies in terms of containing the COVID pandemic. Kasi ano-ano ba yung inuulit-ulit sa atin na control measures, di ba? Kasama na yung wear your PPEs, no, wear your mask and wear your face shields, watch your distance, and wash your hands. E paano ka naman makakapag-wash your hands kung wala nitong tatlong bagay na ito? Finally, let's look at accessibility of health facilities. No? So there has been a uniform drop across these different healthcare services where essential health services, maternal centers, community centers, and mobile health clinics have significantly reduced their services. And only 25% of the respondents are able to meet healthcare and medical expenses of their household members, including children. Hindi na nasama dito sa graph na ito yung issue ng mental health, where 6% of the surveyed households reported severe stress as part of their concerns. So bakit natin to ipinapakita? Kasi dito matatahi ngayon yung concern about immunization. So ang problema kasi natin is that 90% of our childhood population will access their healthcare services or their immunization services rather from the local health center. Ang ginagamit nating statistic is that about 10% will access from private practitioners. Ang great majority ay sa local health center pa rin nagpapabakuna, and kung titignan natin ito and ito, dito natin karaniwan ina-access ang childhood vaccinations, and unfortunately, there has been a significant drop in available services. So bakit ito mahalaga? Kasi ang pinagmumulan natin is actually a crisis that started in 2019. So ipinakita dito or pinapakita dito sa map na ito na nanggaling sa DOH na nagkaroon ng malawakang measles outbreak noong 2018 to 2019. In fact, if you will remember, noong February of 2019, nag-declare ng measles outbreak sa Pilipinas, naitala tayo as bilang one of the top contributors to the global measles outbreak. And bago pa humupa ang outbreak ng mga kalagitnaan ng taon, meron ng 70,000 na naitalang kaso and over 800 people had died. No? So napakalungkot nito kasi wala na dapat nagkakaroon ng tigdas. In fact, before the outbreak was declared, ang target ng WHO is that magkaroon na sana ng measles elimination nitong susunod na 5 taon na ito. No? But naantala na naman siya dahil nagkaroon ng pandemic and on the background, nagkaroon din ng resurgence ng measles. So ikalawa, nagkaroon din tayo ng outbreak ng polio nitong nakaraang taon, noong September of 2019. And this actually was a prediction that had been in place since 2018. So ipinapakita dito sa material na ito na base doon sa National Certification Committee for Polio Progress Report of 2018, na-declare na tayong high risk ng WHO WIPRO. Sinasabi niya na karamihan or 59% ng areas sa ating bansa ay classified as high risk of polio reinfection. 32% are classified as medium risk, and pangilan-ngilan lang or only 9% can be classified as low-risk areas. So nagkatotoo na nga itong prediction, itong progress report na to at ni WHO WIPRO, at nagkaroon na nga tayo ng outbreak noong 2019. Base sa report pa rin ng WHO or rather ng DOH, makikita natin na as of now, no, meron tayong 25 reported cases as of September. 16 ang actual cases or talagang nagkaroon ng paralysis, no? So makikita dito na karamihan sa kanila ay are reported from the Mindanao area. There's one from Cabanatuan. Pero dahil nagkaroon ng contact tracing as a result of identifying these children, meron ding, I'm sorry, let me stop sharing first so I can show you the rest of the graph. Yan. So, base doon sa kanilang contact tracing, meron pang nakuhang iilang mga bata. So, makikita natin dito, there are 7 children here in this cluster in Maguindanao. There's 1 child in Sultan Kudarat and 1 in Misamis Occidental who were surveyed, and based on stool sampling, positive din sila. So wala silang simptomas pero sila ay may daladalang polio. So kaya naging 25 ito ngayon dahil aside from the 16 cases, we also have several cases, 9 children who were found to have polio virus in their bodies, in their system based on stool sampling of either the contacts or from the community. So ano ngayon ang naging hakbang ng Department of Health para sagutin itong problemang to? So nagkaroon ng resolution or ng plano na magkaroon ng nationwide measles campaign. Malapit na itong magsimula sa susunod na linggo. And this actually targets the 2.4 million children under the age of 5 who are susceptible for measles. Paano natin nakukuha tong mga numbers na to, no? So ito yung ini-estimate nating napasok doon sa category ng mga bata na hindi pa nababakunahan dahil naging 9 months old sila or at least 6 months old sila nung panahon ng pandemya. Dahil hindi na nga sila makapunta dun sa mga local health centers, hindi nila natanggap yung angkop na bakuna para sa kanilang age group. And therefore, magkaroon lang ng isang kaso sa kanilang community para na yung sunog na madaling-madaling kumalat tulad nung nangyari nung nakaraang taon. Nagsimula lang naman yun ng pangilan-ngilang kaso. Dahil ang dami kasing hindi na bakunahan, sila naman ngayon ay napakadaling mahawaan. Measles is one of the most contagious diseases in the world. And for those who are not immune, 90% will get the disease. No? So kung ikaw ay hindi nabakunahan or hindi ka pa nagkaroon ng tigdas dati, 9 out of 10 dun sa mga grupong yon ay mahahawaan ng sakit. So for 2020, so far, there have already been 3,500 reported measles cases. There have been 36 deaths. And typically, bata talaga ang tinatamaan ng sakit na to. And most of the cases that have been reported so far are under 5 years old. And thus, to protect against COVID-19 infections, kahit na merong pandemya, yung ating mga healthcare workers are going to be provided with the capacity for PPEs so that a high-quality immunization campaign can be implemented. So hinihiling na sana mag-cooperate ang ating mga parents and caregivers at kanilang dalhin ang kanilang mga anak dun sa mga centers na accessible sa kanila, lalo na kung naka-MGCQ naman yung mga areas, no? And for those communities where this is not possible, then sana kung dun sa mga magbabahay-bahay ay kanilang payagan ang kanilang mga anak na mabakunahan. So, makikita natin dito na kailangan na natin kumilos. Hindi na natin naantayin na magkaroon pa ng outbreak. No? Hindi na natin gustong bumalik tayo dun sa sitwasyon na noong 2018 pa lang nakikita na natin yung pagtaas ng kaso, panay ang encouragement ng DOH and ng pediatricians and the PPS in particular na pahalagahan ng pagbabakuna, no? And yet umabot pa dun sa punto na nagkaroon tayo ng outbreak bago pa nagkaroon ng action, no? And compliance from the public. So ang gusto natin mangyari ngayon is sana ngayong 2021 maiwasan na natin ang paparating na outbreak na ating halos inaasahan dahil malaki nga ang population ng mga batang hindi nabigyan ng bakuna. So ito yung ating target. So this is what DOH has in store. For October 26 to November 25, magkakaroon ng simultaneous measles and OPV vaccination. So susulitin na natin. Total, nandiyan na yung mga bata. Patak lang naman ng polio. Bakit hindi natin sila bigyan na rin ng additional protection? The initial target will be Mindanao, Dakar, Ilocos, Cagayan Valley, Mimaropa, and Bicol. And then sa susunod na taon, itong February, magkakaroon ng Phase 2, also providing MR and bivalent OPV or zone. So inaasahan natin na magiging cooperative ang ating public, ma-appreciate nila yung kahalagahan ng pagbabakuna. Kasi ayaw na natin na mangyari itong mga outbreaks na ito, no, pag nagkaroon na ulit ng opportunity for people to get together, madali na ulit magkahawaan. And hindi natin kailangan na magkaroon pa ng bagong krisis at siya na siguro ang ikabagsak ng ating healthcare system. So ngayon, no, ang laking problema na dala ng COVID, kung magkaroon ba ng mga outbreaks tulad ng measles, ng polio, mahirap nang sabihin na kakayanin pa ng ating health system ang panibagong problemang ito. So let me end that although children are not the face of this pandemic, they actually risk being among its biggest victims. Sana naipakita ko sa inyo na hindi lang COVID ang naiiwan na sakit, no? Marami pang ibang sakit na nandiyan, hindi lang siguro natin nababalitaan. Focus tayo sa COVID. This is to the rights, safety, and development of children. These risks can only be mitigated through solidarity for children and humanity. And we have to work together to make progress on information. So ito po yung ginagawa natin ngayon. We are sharing this information para malaman ng lahat. At sana tayo ay magkaisa. We should have solidarity and work together and act together, the private and public sectors and the community, para tanggapin natin itong ibinibigay sa ating proteksyon na inihain ng Department of Health. So with that, let me end and open the floor for questions. Thank you very much.
Thank you very much, Dr. Anna. Thank you for your insightful presentation. So I'll sum it up first. So we have a small population wherein the pediatric age group manifests for mild symptoms. Okay. Most testing is targeted to sick and exposed. But nonetheless, we should not forget the vulnerable age group, which is the very young and the very old. Okay, and it has now this pandemic has posed significant health threats to child health, for which a lot of our national programs are on hold. Before we begin the Q&A, and we've received a number of questions already, allow me first to sum up some words from the Committee on Immunization of the Philippine Pediatric Society, headed by Dr. Fatima Jimenez. So it is a fact that vaccination is a proven preventive measure in the control and eradication of some of the life-threatening infections worldwide. Fewer childhood vaccines have been given during the COVID pandemic. To avoid outbreaks of vaccine-preventable diseases and keep children protected, vaccinations and well-child visits are essential. We want to drive at that vaccines, okay, continue our emphasis that vaccines are safe. Vaccines are effective, and that vaccines protect everyone. To our media attendees, your press kit will likewise include a circular on vaccination, top 3 safety questions answered, prepared by the Committee on Immunization, posted after today's event and can be accessed by all on the Parents Corner of the Philippine Pediatric Society website. Okay, I will invite Dr. Anna back to entertain some questions posted on our chat box. These were collectively gathered by our press team. So I would like to begin and acknowledge our friends from the Manila Times. Dr. Anna. Dr. Anna.
Yes, I'm online.
Okay. Are you ready?
Yes.
Okay. So as studies prove that COVID-19 could possibly be mild for children and adolescents, for which this is the age group we cater. Okay. Does this mean that the government should now be able to allow children of these ages to go out as long as they follow health protocols?
So thank you, Red, for that question. No, actually, medyo pinagdedebatihan na yan ngayon. And in fact, I think one of the proposals from the economic cluster has been to expand the age range allowed to leave the homes to 16 and 65, no? From the previous 18 to 60, if I'm not mistaken. So, on the one hand, tama, no? Globally, nire-recognize na it seems pagbata, mild. Pagbata, mas madalas na asymptomatic. So therefore, ba't hindi natin sila payagang papasukin na lang ng school? Or kung sila ay mga working students, ba't hindi natin sila payagan magtrabaho? Kasi makakatulong yan sa kanilang mga pamilya. The problem is, when you talk about a particular age group being allowed to go out, let's say, kahit yung mga 10-year-olds, di naman yan lumalabas ng bahay ng sila-sila lang. Siyempre may kasama, no, may adults na ina-accompany sila, and allowing them to go out also means providing the means to go around, which means increasing public transport. And also an additional complement of adults who will support the movement of these children. No? So sa tingin ko, no, very attractive yung idea. It's actually a step towards normalization. It answers those issues about education. Pero isipin natin ng maigi yung impact on the system. I think yun usually ang dapat nating titignan rather than pockets of population na sinasabi natin pwedeng lumabas. Kasi pag lalabas ka, ano ba kailangan? Kailangan may public transport ka. Kailangan sapat yun, no? Very critical kasi para masigurado natin na yung physical distancing nasusundan, and of course sana yung your personal protective equipment continue to be implemented, no? That's a must.
Okay. Yeah, I realized because we are anticipating Christmas soon. Sa Pilipinas pa naman, Christmas na. So kumbaga, ang daming plano na maapektuhan. But I guess the question also poses, is this personal good or looking at it as a national good for being able to contain diseases? But on vaccination, ma'am, on a question regarding vaccination, do you think the misinformation about vaccination, especially during the Dengvaxia crisis, affected the immunization program of our country?
Ang hirap sabihin hindi, di ba? Tapos ang sarap sabihin mag-move on na tayo.
Yes.
Lumang balita na yan, no? Pero hindi, we have to acknowledge it's a reality, no? Alam mo, nabanggit ko to dati, nung panahon ng measles, syempre ayaw natin magkaroon ng crisis, pero I think that was a way for people to realize na may mga ligtas ang karamihan ng bakuna, no? And in fact, when we talk about the concern about the dengue vaccine, this was really more of an information issue rather than an actual danger. No, kung titignan natin yung experience ng iba't ibang bansa, wala naman sa kanilang nagkaroon ng any deaths related to the vaccination. And in fact, even in the local setting, no, wala rin tayong matibay na correlation, no, where we can say we are very, very sure na yung death na yun ay dala ng bakuna. May mga ibang identified factors. No? Meron kasi tayong tinatawag na adverse event following immunization surveillance, and meron din tayong independent na tumitingin nung mga naging adverse events, and tinitignan nga nila kung may relationship or wala. So dahil naman unfortunately tumatak yan sa public, no? I'm hoping na sana yung naging magandang experience natin para sagutin yung measles outbreak, which primarily consisted of a vaccination program, yun naman ngayon ang tumatak sa isipan ng mga tao. Kasi 'di ba nakita natin gaano ba kabisa nung nagkaroon tayo ng measles vaccination program. That was actually the answer. Yan ang sumagot dun sa outbreak. So sana ngayon din, yan ang maalala natin para makaiwas tayo sa panibagong outbreak. Dapat i-avail natin itong mga ligtas and libreng bakuna na ipinamimigay na naman, hindi naman natin kailangan pang bayaran.
Okay, thank you. Thank you, Doctora. I hope that also answers the question of our friends from the Euro TV News na paano malalaman kung ang vaccination ngayon ay safe when way back the time of dengue vaccine, may vaccine failure noon.
So siguro let me just clarify that din, ano?
Yeah.
I think nagkaroon talaga ng misinformation. So I'd like to put that out there, no. Hindi ang naging issue is misinformation. So napakalaki talaga ng role ng media para ma-share yung tamang information and magkaroon ng science-based reporting.
Yes, thank you very much, Dr. There's a question from GMA7, and they said, based on your slide, hundreds of thousands of additional child deaths could occur in 2020, reversing last 2 to 3 years of progress in reducing infant mortality. How is this reflected on the local setting? So what is our local projection then, now that we had a lot of national programs on hold because of the pandemic?
That's a very interesting question, no, Cedric. Para sagutin yan, ang kailangan talaga natin yung tinatawag na excess mortality. Meaning, kukumpara natin yung number of deaths per age group sa period na ito, kung kailan meron tayong pandemic and meron tayong community quarantines versus a similar period in the previous year. Para makita natin gaano ba kataas yung itinaas or gaano kababa. And then, sasabihin natin, since ang pinagkaiba lang naman ng dalawang time period ay yung lockdown and COVID, malamang dahil yon sa impact ng COVID. No, not necessarily COVID deaths, but all the fallout. May pneumonia na hindi nakarating sa ospital, or nagkaroon ng diarrhea, hindi na nakarating sa ospital at nangamatay. No? So, unfortunately, we don't have that kind of data yet. But yung projection nga na sinishare ni WHO is very intuitive kasi makikita natin kung kailan nawawala ang access to healthcare, kung kailan nawawala ang basic services, talagang yan ang impact. Merong modeling coming from the Ebola and actually primarily the Ebola outbreak in the African continent. That is the basis for that statement coming from the that WHO policy brief.
Salamat, Cedric, sa tanong. From Miss Faith, okay, since there are children who are delayed in the immunization program, is it recommended to administer two or more vaccines to children or babies in one session? What is the maximum number of vaccines that a child can receive in a session? Would you suggest na maghabol na sa immunization? Thank you po. Thank you for the question, Ms. Faith.
Thanks, Faith, no? Huhulaan ko siguro mami to kasi alam niya na pwede magsabay-sabay ng bakuna. Actually,
Yeah.
pwede, no? Hindi lang natin ginagawa kasi parang syempre minsan isipin mo, ay nakakaawa naman, nakatatlong tusok tong batang to. But actually, wala namang limit to the number of vaccines that a child can receive during a single visit. In fact, in developed country settings where siguro napaka halaga nung time off from work, no? May mga visits sila doon na as many as 3 vaccines are administered at a single time. So 3 tusok yung natatanggap ng bata. And regular schedule nila yon, no? So dito sa atin, dahil siguro medyo mas may leeway naman tayo, mas malaki ang ating family support, karaniwan nakakaisang iniksyon tayo, isang patak. Pero pwede kang actually as many as 4. 4 naman yung pwede mong pagturukan. Pwedeng 4, pwedeng 8 pa nga kung kailangan, no? And that's not going to impair the immune response. Siyempre, masakit sa katawan, no? Pero hindi siya bawal. In fact, pwede siyang gawin. So, dapat bang maghabol? Yes, no? Yan ang tinatawag na concept ng catch-up immunization. And in fact, for children who are delayed, ang ginagawa dapat natin is ina-assess natin ilan na ba ang kulang nitong batang to, kaya ko ba itong ibigay ngayon lahat sa kanya kasi available naman, and kung pwede, ibibigay mo na ng sabay-sabay para hindi na niya kailangan magpabalik-balik pa, which is the challenge now in our system.
Thank you, Dr. Ana. Any advice
Mami nga
on
si Faith? O, tama daw. Mami nga si Faith.
Nagparamdam ba si Ms. Faith? Okay. Any advice on hospitals who want to establish an immunization program?
Okay, that's actually something that healthcare facilities should explore. One of the things that I actually brainstormed with in some of the groups that I was talking to in the past was maybe an immunization tent can be set up outside of the hospital area. Kasi ang reservation ng parents is ayoko pumunta ng ospital, ang daming may sakit doon. So, may ibang families akong nalalaman na they prefer to visit their doctors in the standalone clinics that some of their doctors will have rather than going to the hospital kahit mas malapit. Pero kung ang concern ng magulang is ayokong pumasok sa ospital, kung gumawa ka kaya ng parang satellite area near the hospital compound kung saan yun lang ang binibigay mo, well child service by appointment, hindi kaya yun makaengganyo ng mas magandang follow-up. So that could be something to explore as well.
Yes. I guess we just need to be creative,
Yes.
innovative with our plans, programs,
That's right.
no? Because we need to instill intervention. So vaccination pa rin talaga. Okay. Also from Dr. Joanne Millonado, are there new guidelines on pneumococcal vaccines, especially for those who have not completed the primary series?
So thanks, Joanne, for that question. No, actually, I was looking for new age-based guidelines. Kasi, di ba, alam natin na typically ang pneumococcal conjugate vaccine is given for children under the age of 5 as a 3-dose primary and a 2-dose booster. Pero maraming ang na-disrupt dahil doon sa pandemic. So currently, the guidelines are still the same. They haven't been revised. And despite the fact that you kind of want to think, will additional protection be helpful even for those age groups beyond 5? Dahil may COVID, walang ganong klaseng bagong recommendation. So ang susundin pa rin natin is the old recommendation for the primary series. And if children miss the doses in between, there are age populations where you don't have to complete as many doses anymore. Hahabulin mo na lang yung remaining. Kasi lumampas na sila dun sa period of highest risk.
So what is to administer what is appropriate for age? Is that
Yes.
Okay. I think this is more a question. I think this is Dr. Maria Teresa Reyes. More a question for PPS. As accredited training program, can we allow our residents in full PPE to attend and assist in the phase 1 and 2 vaccination of healthcare centers? Okay. So we will deploy our trainees to administer well vaccinations. Do you agree if we can make a move about we can assist the government in these health programs?
So, let me give this answer in a personal capacity kasi hindi pa napapag-usapan to ng organization. Siguro what I can share is that si DOH really values the assistance of the Philippine Pediatric Society. This is coming from the success of the Ligtas Polio campaign from the previous year. No, naalaman natin na dahil nagkaroon ng hospital-based fixed posts, ang polio immunization program and ang pediatricians ang nag-administer, maraming nag-avail nung doses ng polio na pinamimigay ng DOH. So we wanted to replicate that success, and one of the things that we are exploring and we're encouraging the chapters to do is to partner with the DOH teams on the ground in their areas to see kung paano nila pwedeng isupport yung mga field teams either through publicity or maybe to set up a post in a hospital, yung tulad ng ginawa natin sa sa polio campaign.
Yes.
So certainly itong allowing the trainees to participate can be explored. Pero I think this needs to be a discussion in the hospital accreditation board and the subspecialty board committees para matignan yung impact on training.
Yeah. But I think some hospitals, I'm proud to say my institution as well, has joined with our local government in pushing through in promoting their health programs as well. So we've
Congratulations. Sana lahat, no?
Yay! Yes,
very good
sana
yan.
lahat. Oo.
Sana all.
Para we can cover all, right?
Right.
Okay. So I hope you can keep track of the dates for all of our attendees. the programs that the government is trying to um, promote for health and wellness of our children.
Oo,
Okay?
sana magkaroon ng big push on October 26, no? Magandang ano yan, magandang move para maalala ng
Oo,
lahat.
subaybayan po ng lahat para sabayan natin. Or ngayon pa lang nagpe-prepare na tayo para masabayan natin. Pakiramdaman ninyo ang mga ang paligid ninyo from the barangay level, your local health center, all your affiliations, makikisabay tayo, okay? Kasi there's more than COVID out there, right?
Yes, that's right. Totoo yan.
Okay.
Lalo for children, 'di ba?
Yes.
Mm-mm.
Yes. Would there be any more questions from our audience? Okay. I have one. I guess this is Dr. Rowena Nieto. Can OPV, MCV, MR be given for COVID suspects, exposed kids who are asymptomatic or symptomatic? Is there a schedule for that?
So, in general kasi, pagka meron tayong suspicion that a child is incubating some kind of disease, we typically want to let it run its course first, primarily because of the confusion that vaccination given at that time can lead to. So hindi dahil natatakot tayo na magkaroon ng additional harmful effect. It's really more of pagka nagka-sintomas na ikaw naman ngayon ang malilito, naku ano ba to? Vaccine reaction ba to o dahil dun sa ini-incubate niyang sakit? So para na lang sumimple ang buhay, hindi na tayo lahat matakot, patapusin muna natin yung incubation period galing dun sa exposure na yon, which is a 14-day period. Tapos pag lumampas na siya dun sa 14 days na yun at wala naman naging symptoms, then you can proceed with giving the due immunizations.
Okay. So, Doctora, this is from Dr. Jess Acantilado. Post-COVID adolescents, when can we give the next live vaccine?
Okay. So, again, no, that's been a very active area of investigation. Unfortunately, wala namang may experience dahil napakakonti pa nung ating kaso na nagkaroon ng COVID, lalo na documented or severe COVID. Pero typically, for the adult population, there's a CDC guideline that says you wait until at least 2 weeks. And the concern primarily is more because they could be transmitting the disease. So parang yung perspective ni CDC was, we want to avoid further spread. We want to make sure that the case has been properly isolated, and therefore you want to wait until after the illness period before you resume the immunizations.
Oh, okay. So 14 days minimum. That is from the onset of illness.
Yes, correct.
Okay, yes. Which is a perfect time for follow-up anyway.
Yes,
and
exactly.
With every follow-up is an opportunity to update our wellness advice for children.
Yes, so
okay.
not just vaccination, no? Although we're focusing on that now, but we want to also look at all aspects of preventive care as well.
Yes, okay. So, Dr. Garcia, I'm not quite sure, but he added a comment, 90% taken care of the government, which is public, with limited public health personnel indeed need help from the private sector. Oh yes, tulungan. I guess that's a very good comment. Yes. Right now we work as one. Di ba yan ang ating
Yes.
banner? Okay. For those 19 and above, can we also give PCV or PPV for 2 doses 5 years apart? This is from Dr. Lamez Jamco.
So that's actually related to the question of Dr. Joanne earlier, no? Basically asking if there are new age-based recommendations for pneumococcal vaccination in the context of the pandemic. Unfortunately, wala. Parang hindi sinasabi ng mga recommendatory bodies na ay dahil may pandemic, magbakuna tayo for pneumococcus dahil tumaas ang risk. Hindi ganoon ang perspective. The perspective is, first you identify yung mga typical age ranges na sino dapat ang binabakunahan, bigyan mo sila kasi ang gusto natin makaiwas ng further burden on the healthcare system And sana hindi na mga ospital to mga taong to dahil meron na silang protection. So both for pneumococcus and flu.
Okay.
The old age bans apply.
All right. So we should be reading the inserts and the recommendations, listening into the recommendations for
Yeah.
proper administration.
Right.
I have a couple more, pero I can only entertain one more question. And I think, what advice can you give to parents who buy their own vaccines in the local pharmacy and bring it to the OPD for administration? This is from, I'm not sure. Okay, from one of our,
Sige.
yes.
So let me address that, no? I guess, di ba, parang that's really just born out of the concern na syempre gusto nilang up-to-date yung bakuna ng kanilang mga anak, hindi nila ma-access yung kanilang provider, di sige ako na lang, gagawa ako ng paraan. So ang concern lang doon is, tandaan natin, ang bakuna is a very maselan siyang product, no? Hindi yung
Oo.
pwede mong saan-saan lang siya bilhin, saka saan-saan mo lang siya dalhin. It's really the cold chain that's a concern, no? So, may mga botika kasi na ang gagawin nila dun sa kanilang products na coming out of their medicine refrigerator, lalagay nila sa plastic bag na may ice.
Yes, for cup, may
hindi
parang like
appropriate.
a coffee cup.
Oo, no? So hindi pwede yun eh. Kasi alam nyo ba na ang gusto talaga ng bakuna is temperature of 2 degrees hanggang 8 degrees. So sing lamig dapat ng ref natin kung tama ang temperature ng ref natin sa bahay. So dapat ganun yung tina-target na temperature. So kung sakasakalit gusto nyo yung gawin, you got agreement from your healthcare provider, na sige, ikaw na lang ang bumili, ako magtuturok sa'yo. Responsibility mo ngayon bilang consumer na i-ensure na nandoon sa 2 to 8 yung kinuha mong bakuna, you maintain it within that range bago pa makarating yun sa healthcare provider mo at maibigay sa'yo. Otherwise, sayang lang yung ginastos mo. Wala yang silbi kasi yung bisa ng bakuna, wala na.
Yes.
No?
Okay.
And then of course, let me also remind people, no, lahat na lang kasi ngayon may fake eh. So let's make sure we purchase from reputable suppliers, reputable dealers. Hindi kasi lahat ng nagbebenta eh may authority, no? Lalo na yung mga sa online, medyo hindi natin busisiin din natin ng maayos na sila ay legitimate and hindi fake na products ang ipinapakita sa atin or ibinibenta sa atin.
Otherwise po, please reach out to your doctors, your pediatricians. They're out there, okay? And they will make sure that when you avail of your vaccination or go through your well checkups, they will ensure safety on all levels, hindi lang sa clinic nila. So, ang dami niyang proseso na pwede kayong alalayan. Huwag po kayong matakot, okay? So, and there are so many ways for you to update your vaccination.
Tin, there's 2 questions here in the chat box that I'm seeing.
Pwede
Do you
pa ba?
mind if I address them?
Oh, sige po, ma'am. Sige, what did you see, ma'am? Baka hindi ko napan.
So kasi, kasi there are 2 questions that are related from Cedric and from Present Parenting Solutions about bringing their children to the clinic.
Go ahead,
parents are afraid of bringing their children to health facilities dahil natatakot silang ilabas yung mga bata. So what can we advise, no?
Yes.
So that's a very valid concern. Di ba ang atin ng recommendation, kung hindi kailangan lumabas ay wag nang lumabas. So ito na nga, kailangan ba itong gawin o hindi? Yun ang tanong. So ang sagot doon is yes, kailangan nating i-ensure na up-to-date ang bakuna ng mga bata. So, paano natin gagawa ng paraan para safe yung paglabas nila? So, kung sila ay may private healthcare provider, marami ngayong doctors and karamihan sa mga doctors ngayon by appointment na yan humihingi ng schedule. Hindi na pwedeng bastang mag-walk-in at ako'y magpapabakuna. So, bakit nagpapa-appointment? Kasi unang-una, doon pa lang sa phone, siniscreen na kung ito bang batang pupunta sa clinic ay well child or may sakit. Kasi tandaan natin, hindi lang naman yung anak mo ang pupunta ron. Yung mga makakasama niya dun sa clinic session na yon, kailangan din nating proteksyonan. So typically what the pediatrician will do is lahat ng mga well children magkakasabay, lahat ng mga sick naka-appointment. No? And then yung sinasabi kong magkakasabay, hindi yun magkakasama lahat sa isang waiting area, naka-time. No? So ikaw darating ka kunwari ngayong 11 o'clock, maya-maya yung susunod 11:20, yung susunod 11:40 para hindi na kayo nagkakasalubong. So there's an appointment system. This is set up by calling in first. And then, of course, your advice na paano ka ba pupunta dito sa hospital, may health protocols. And then we try to go through the visit as quickly as possible. A lot of the questions are on the phone already para pagdating, physical exam, turok, uwi. Mabilis.
Yes, I've heard about that they schedule. There is a two-part process for your well child visit. Some they do the teleconsult, which is pretty much at least 20 minutes to 30 minutes for some, very extensive, and really sets the expectation for the actual visit, and the actual visit is as short and quick as possible. That's a
Right.
good strategy. That's a good strategy for that matter. And for advice there was a question about for those who cannot afford to give vaccinations all at once. I think also which should you prioritize, your flu or your pneumococcal vaccine?
Medyo mag-iisip ako ng matagal-tagal ng konti
I
dyan.
know.
Kasi parehong importante. Yun yung
Yes.
problema. Pero kung titignan natin yung age-based recommendations, ang flu universal for 6 months onwards, di ba? Taon-taon. Wala kang age limit. Lahat binabakunahan ng flu. Tapos ang pneumococcal, meron kasing mga pockets na fino-focus natin, yung under 5, yung above 65. Kasi ang recognition na dun sa gitna, yung risk is a little lower compared to yung extremes of ages. So based on that, I would say off the top of my mind, flu. Also because, ito rin, katulad siya ng COVID eh. Diba? Maraming overlap ang flu and COVID. So, if only from the practical perspective na gusto mo sanang pagka magkaroon ka ng simptomas, alam mo na ano ba ang tsansang flu ito versus ano ang tsansa ng COVID, it helps you and it helps your healthcare provider na, sandali, itong simptomas na to, bakit siya magkakaroon ng ganyan? Eh, nagbigay ako ng flu vaccine, maganda naman ang match this year eh. Baka dapat mag-explore na ako, baka COVID to. So, mapapabilis yung process ng assessment.
Okay. Thank you, Doctora. Thank you for that. I'd love to entertain more, but I will try to collate all of your questions for all of from all of our guests and send you all the answers to those questions.
Time lang ulit, pwede ko pa itong sagutin. Sorry ah.
Wow!
Kasi lumalabas sa chat box. Last
hindi,
na talaga,
which is
promise.
nice. Sige.
Oo. Ito lang yung tinatanong kasi kung paano kung sa public health dinadala yung sa healthcare center dinadala yung anak for vaccination. That's a very relevant question. No? So, iba-iba kasi ang patakaran ng mga local government units. So, may mga local government units na nakakapag-maintain pa rin sila ng kanilang regular vaccination schedules. Yung iba medyo talagang na-divert sa COVID yung response. So ang suggestion ko ganito sa mga nanay, alamin ninyo kung ano ang vaccination schedule dun sa inyong local health center. Kung mine-maintain pa rin nila yung kanilang daily schedules, no? Ang suggestion ko, mag-set ka ng appointment. Kaibiganin na natin yung ating mga health center personnel, sabihin na pwede po bang bitbitin ko yung anak ko ng ganitong oras kasi gusto kong habulin yung bakuna niya. Para pagdating mo doon, ready na sila, ready ka na rin, mabilisan kayo. Tapos syempre habang nandun kayo, dapat yung proper naka-mask, naka-face shield, huwag masyadong didikit sa mga tao, tumulong na tayo mag-maintain ng pila para lahat din ma-entertain ng maayos.
Sige. Thank you, Doktora. May gusto ka pa bang tanongin? Ay, sagutin, ma'am. Yan ang gusto ko sa inyo, ma'am. Ganado ka. And nice that we can have this
yung mga tanong naman, actually, ito talaga yung concerns that we wanted to answer.
Yes. And I guess we are in good company. The people who can send out our message about wellness.
Yes.
Okay?
Yes.
And I think this is a perfect time for preparation. Our vaccination is preparation from when we are less restricted, likely.
Yes,
okay, which is in the future. Okay.
So we're looking forward to that, and sana hindi naman maging kadugtong nung easing up of community quarantine ang maging kasunod naman nung mga vaccine preventable disease outbreaks. Nakakalungkot kung mangyayari yun.
Yes, okay. Sayang ang efforts natin. These are
Yes,
decades of protection, right? We cannot
exactly.
have them
Exactly.
re-emerge. Okay,
Yes.
so thank you for being patient in answering our questions on vaccination, Doktora. Salamat po. Okay. So before we end this program, may we hear a few words from the Vice President of the Philippine Pediatric Society, Dr. Florentina T.
Good morning, everyone. Thank you again for joining our session for another opportunity for learning. The topic for today is really fitting for us pediatricians, knowing that immunization is our best armamentarium, because in our practice, has been proven to be effective in the control and eradications of vaccine preventive diseases in children. Now more than ever, we have to continuously enrich our learning to better serve the Filipino child and the community. So in behalf of the Board of Trustees, we would like to thank our speaker, Dr. Anna Ong Lim, for sharing her expertise in the topic on pressing concerns on immunization during the COVID pandemic. To our moderator, Dr. Christine Tambolyong Paras, to the council directors of the Philippine Pediatric Societies, continuing professional development, to our public press, relation engagement relation system services chaired by Dr. Bambi Casala, to our committee on online CPD chaired by Dr. Flerida Hernandez, to our committee and continuing scientific session chaired by Dr. Christine Gutierrez, to our committee on child health informatics, Dr. Judith Garcia, to our secretariat, June and Carl, and finally to our Almighty God for making this activity a success. Again, thank you everyone, and looking over for the next session. Take care, keep safe, everyone. Thank you.
Salamat, Dr. T. Thank you too for the recognition, but most especially the Philippine Pediatric Society deeply appreciates everybody's participation in this media conference. For all of you who joined us in Zoom, who are on YouTube, we hope you learned something today, but it doesn't end with you. We hope you can spread the message of all these efforts to safeguard the health and wellness of the Filipino child. So we have this to show you. I hope you help us and let us champion immunization. Good day to all.